Over 26 million people in the United States live with asthma. In 2020, there were 980,000 emergency department visits and 94,000 hospital inpatient stays due to asthma in the United States. Asthma-related costs in the US are significant, with an estimated annual expenditure of about $80 billion. Today, we talk about Keva Health, a company formed when the founder's daughter was diagnosed with asthma at the age of 3. Keva Health is a pioneering company that provides solutions to assist with monitoring and improving health outcomes for asthma patients by offering real-time feedback, enabling them to monitor their condition closely. Join me today as we talk to Jyotsna, the founder of Keva Health. Jyotsna is an accomplished professional bringing over 20 years of combined experience in academia, regulatory affairs, and the pharma industry.
This episode is brought to you by MeshAI. MeshAI is a scheduling software for healthcare workers, including medical students, residents, physicians, and nurses. It alleviates administrative burden by leveraging AI algorithms for scheduling shifts. MeshAI automates the creation of equitable schedules, efficiently assigns the most suitable staff for each shift, and facilitate easy shift training among healthcare professionals. MeshAI is more than just a scheduling tool. It's specifically designed to cater to the unique training requirements of each residency program. By integrating advanced features, it not only manages the schedules, but also supports the specialized training needs of healthcare professionals, ensuring that the training needs of each residency program are met. Jyotsna, I'm so happy to have you here today.
It's nice to meet you, and thank you so much for inviting me to your podcast.
It's a pleasure to have you. I'm very honored to have you here today, and I really want to talk about Keva Health and your stories. It's been very inspiring. I read about you. I went through the podcast, I went through the website. I've seen what you've done. And can you tell me what inspired you to create Keva Health and how your personal experience shaped the company's mission?
Yes, thank you. So the reason I started Keva was really two reasons. One was my 3-year-old daughter, when she was 3 years old, was actually diagnosed with asthma. And as parents, we did not have anybody in our family who had a similar condition. So a lot of her care management that was given to us by the doctor was very new to us. We had to understand what an action plan means. We had to go close to her and understand what wheezing means and what breathlessness was. So it was, it was tough as parents who did not know how to deal with such a little girl having a breathing condition. And of course, later on, as it progressed, there were times when I would have carried her in my hand in the middle of the night when she had a flare up, because the doctor would say, you got to go to the hospital. There's nothing much I can do over the phone here. And so a lot of this inspired me to think about, how patients like my daughter would be suffering from this type of disease, and how it is difficult when in the middle of the night you can't breathe, or you get up early in the morning and the pollen count is really high outside. So most of our thinking around building something for respiratory care really came from this patient's story. And of course, as we progressed, a lot of my career, so this was the second reason, is that my career, I had spent, I'm a pharmacist by training, and I spent about 25 years in the area of health economics and outcomes research. And so what was important for me was, and what I did in my career was to design real world studies, to look at data and to help reduce economic burden for a specific disease as a result of bringing drugs into the market. And so it was very important for me to think of, digital health as a very similar, almost like a prescription for drugs. So just like you have a prescription for drugs, you have a prescription for digital health. And I saw that future coming. And so it was very important for me to combine those interests, the work that I had done in that space, combined with my daughter's story, and of course my interest in digital health, and that's how Keva came into being.
It's very interesting. Most of my guests have a personal story. Actually, I can't recall a guest who went to the health tech space without a personal story. I believe like personal stories are the best motivators.
Yes, I couldn't agree enough.
Can you tell me more about the technology behind Keva's health solution? Particularly, like, how do you use data and real-time feedback to improve asthma management?
Yes, absolutely. And I'll clarify one more thing. So we started our case study or our use case with asthma, but because we have a very generic engine / platform that we've developed, we are able to expand it into many different respiratory diseases. So this includes COPD, pulmonary fibrosis, cystic fibrosis, bronchitis, and so on. And so our goal here is to go deep into the vertical for respiratory care and identify disease management approaches for each of these disease areas. And then our generic engine is able to customize the disease management plan for each condition, as well as combine it with what we describe as remote patient monitoring or remote therapeutic monitoring. So remote patient monitoring entitling physiologic monitoring, which is through devices. And so we bring in data from these devices that the patients are using into our platform, and that allows our care team to look at the data and to predict if somebody is getting an exacerbation, getting a flare-up. So the whole concept is to use the engine and design it, customize it for these different disease areas, and then make sure that we are looking at this data on a daily basis to see who is not doing well, who is doing well, and who is in a likelihood of getting or becoming worse, so that we avoid the patient from going to the ER.
Yeah, I can't agree more, because like when it comes to obstructive lung diseases, not asthma, like you said, like I did my internal medicine residency and I spent 4 years in the emergency admitting patients with COPD or asthma exacerbation to the ward. And it just like happens. It's just like your muscle becomes so, your airways suddenly contract and they can't relax. And there are triggers that you can avoid to prevent this from happening. And as we saw in the introduction, like the costs of not avoiding, actually, the cost of not avoiding the exacerbating factors and going to the emergency, it costs the healthcare system a lot.
Yes, absolutely. I couldn't agree enough. And so our goal here at Keva is to, prevent, even if we prevent one ER visit from happening, we're looking at savings of, between $5,000 to $15,000, right? And if our program cost was $1,000 a year, even if we save one ER visit, we have tremendous opportunity for these patients, to reduce the economic burden and to not avoid these unnecessary hospitalizations. Readmission rate, as you may know from your experience for COPD, is at 20%.
Yeah, it's very high. I know there are some patients get admitted again and again.
Absolutely. So I think our goal is obviously to provide a solution. And again, we are the disease management piece, right? We are not doing it entirely, but we are trying to change the concept of episodic management of disease to continuous management of that disease. And that only comes when the patient leaves the doctor's office, comes home, and their next visit is, 3 months down the road. But what really happened in those 3 months is what we want to capture at Keva.
Gotcha. Take me through the patient journey. Let's say I'm a patient and I hear about this app and I downloaded it. So like, which app stores is it available? I downloaded it. What should I do next? Should I pay for it or not? Like, take me through the patient journey.
Absolutely. So we are actually using the concepts of remote patient monitoring, remote therapeutic monitoring, and these have been built in to our platform. And so the way those codes work is for billing is that when a patient visits the office, we work with the physician provider. So we are, typically signing a contract with the physician provider or with the hospital or with the healthcare system. And as part of that, when you visit your doctor for a visit, and if the doctor thinks that you should be on the Keva program based on your severity, based on your comorbidities, they will ask you a couple of questions. They will offer the program to you. So it's almost as if you're getting, as you get a prescription for your drug, you're getting a prescription for a digital program. So once the patient knows more about it, you will be given a brochure. You can ask the front desk to give you more information. And if you consent to the program and say, this sounds like a great program for me, I would like to join it, that's when you are officially onboarded on the program. So your initial prescription for this program, if you may, happens at the doctor's office. Once the doctor and the patient agrees, the office or the hospital or whoever we are working with will inform us either through our platform or through a message letting us know that this patient has now joined into the program. And from then on, we essentially take care of that patient. So we will ask them to then download the app. We provide the username, password. They can set it up. We onboard them on the platform. We send them devices through mail. We set up an onboarding 45-minute call to introduce them to the program. And it's a simple video call. So all of it is done remotely. We are not even present at these offices. We just need to know that these are the patients that can be participating in the program. And then from then on, our care team essentially onboards the patient. We do a 45-minute video call. And then the patient then learns how to use the program, how to operate the devices. We have two-way messaging. We have a support system so they can let us know if there is any question or issues that they have. And we work with the provider's office and bill on a monthly basis. Because a lot of this is not a one-time approach, right? Where you go to the doctor, you get you let the doctor know what disease you have, and the doctor takes care of you. You pay for that service, your copay, and then you leave the office. Here, we are continuously monitoring the patient from the time they join the program. So so what we do is referred to as a monthly program in a way, because every 30 days, we check how the patient is doing. We send a report after every 30 days to the doctor as well as to the patient, so they know exactly, what their readings are, how they are doing. And they can communicate with us as well because we are sort of their extended care team, so to speak. And then we also communicate with the office as well as the billing provider to make sure that they're able to bill for the codes that the patient satisfies.
Are there any medical devices that are also associated with the software? Like is there an oximeter or like a puffer or like bedside, or point of care, like a small spirometer?
Yes, absolutely. So right now we are device agnostic. So we are able to work with different types of device companies and bring in whatever is useful to the hospital or healthcare system we work with. But typically, most often for patients who have COPD, asthma, the spirometers are very useful. And they offer a complete spirometry session, including lung function loops, plotting the FEV1s, and all the different parameters of lung function. They get recorded with each session that the patient performs at home. And all of those 15 parameters are available for our care team as well as the doctor to review. We also do the oximetry readings. So that includes O2 sat, heart rate, whatever is available through the oximeter. And these are all either Bluetooth connected devices, or in the case of oximeter, it can also be 4G, 5G connected, which means they don't even need to have the app. They can directly take their reading. The reading transmits into our platform, and we can monitor that patient.
Gotcha. Okay. And so you mentioned that you are device agnostic. So the main service that you provide is the software. Is that correct? Is that the case?
So yes, we are a health tech platform company. So we are providing access to the platform. The platform has integrated with these devices for them to work, right? So if the device is not integrated with the platform, then the patient cannot use that device and transmit the data. So it's very important that the devices are integrated with the platform, and the app that we have designed for each specific disease is also connected to the platform.
Gotcha. And if things start going south, let's say like I'm a patient and there are some alarming things on my test, whether it's blood oxygen or it's the spirometer, what happens? Who gets notified?
So that's a great question. So typically we have sort of a care team approach, and it can be done either way depending on what the provider is looking for. But what has successfully worked for us is an approach where we have alerts and escalations that are set up automatically in our system. We also have the care team looking at this data, but also it generates those alerts automatically. So when somebody's lung function is going downhill over 3 days, or let's say they themselves have entered that they are not feeling good, or they're showing a sign of deterioration or some sort of, feeling that they have breathlessness or any kind of symptoms that make them not feel good, then they can enter the app and they can check into the app and kind of let us know how they are feeling. And so this happens on a daily basis, right? But obviously you may not be checking the app all the time, or you might be traveling or something. So when we get these messages, we are continuously tracking them along with the readings that the patient is taking. So when we look at the combination of the two and we feel this patient is not doing well, we have a protocol that we work with each office that we work with. And that protocol might say, and every doctor is, practice is different. So they might say that if somebody tells there's a red alert or they're not feeling good at all, then I want to know right away. Or if somebody has a yellow check-in, which means, they have symptoms, they've done their device readings are low, and so we need to call them. So we work with the office to decide what that protocol is that they are comfortable with. Typically, when we have red check-ins, it means they have to call 911. Gotcha. And so in that case, we get the alert and we typically call the office. We let them know as soon as possible. And the patient, typically, depending on what their condition is, they might call 911 or, go to the hospital if they have to, if obviously they are very severe. But if they are, if it's a regular day and they can call the doctor and speak, then that, makes it very advantageous for them. Because the doctor, talking to the doctor when they're not feeling well is a big relief for them. But there are times when they are not doing well and it's very hard for them to pick up the phone, connect with the doctor. They might be at the receptionist. It's a busy office. So things like that. And that's where some of our work is useful, because then we are sort of that channel that helps the patients, get access to the doctor quickly. Gotcha. And any alerts that come from the Keva team are considered as high priority. So they get, or we always connect to the EMR as well. So we can put in a task for the doctor as well. So they are busy with other patients, but they can review their task at the end of the day, during the day. So we've created these alerts that are either, very severe, alerts that are somewhat severe, meaning, the patient is doing okay, but for the past 3 days, they've just not been doing well. And then there are patients who obviously who are doing well, who are green, who are doing well, then they don't need to worry. So depending on how your condition is, we decide if our care team wants to call them, right? And say, hello, how are you doing? We're seeing a decline, or we saw your SpO2, hitting 94. So is everything okay? Would you like us to call the doctor? Things like that. So we are already checking with them as to how they are doing. And then the second level of care comes when we let the office know that, we have an alert in the system. So an alert is different from escalation, right? An alert is when we are starting to see something decline. And escalation is when there is a problem. There's 3 days where the patient is not doing well. There's a red alert in the system. The patient has indicated, that they are absolutely not doing well.
Gotcha.
So when things like that happen, then we kind of step in. We make sure that the office knows right away as to, what's happening. Sometimes we will also attach reports. So let's say they measured their SpO2 at, 6 p.m. And at 7:30 p.m., we see a call or a red check-in from the patient. So we know that something is going downhill. We have the latest report. The vitals are taken. So we can call the doctor, put in a message, or put it in their system. Obviously, after regular hours, you're obviously seeing an on-call doctor. But instantaneously, those messages are put in so that even if it wasn't as severe, when the doctor comes back next day at 9 a.m., they see it first thing in their system.
Gotcha. And when it comes to like asthma, I think you have lots of people in the obstructive diseases in general, asthma specifically. You have lots of young population, and you also have like the old population with COPD who are smokers. How do you make sure that your patients are adherent to using the solution, the app? How do you make sure that? Is there any way of making sure that you can engage the patient all the time to use the app?
Yes, absolutely. And I think when it comes to these programs, any kind of program that is offered at home, where it is not that the doctor is right next to you saying, you got to do your reading or you got to check it into the app, always becomes somewhat, the system has to be developed so that engagement and compliance are good. And so what we have done is we've made the app pretty engaging for the patient. And the same is true for both the younger generation, the kids, as well as the older generation COPD patients. So we made the app pretty simple to use. We also allow patients to set their own reminders when they are doing their check-in. So that's just an example, right, of how we made it easy for them. So if you want to do your reading every day, maybe you want to do it right after work, after you have your cup of coffee, you want to do it at 4:30. Somebody else might want to do it at 7 a.m. because they have a job that starts at 8 a.m. So we've made it easy for them to decide how they would like to monitor themselves. And then obviously we seek feedback from patients as well. But at the end of the day, reminders and alerts are pretty common. And so to nudge the patient, so we have obviously 3 categories, as I like to call it, of patients. One who are super engaged, right? They love technology. I want to take care of my health. I want to feel better. And so there we don't have to do too much, right?
Exactly.
Because they're already very engaged. They're already doing their work. And so we love those patients. But then there are those patients who need a little nudge. And, oh, I forgot, or, I should have done this. And so we send them alerts, notifications through our app on a daily basis. We also sometimes will make calls if needed. Our goal is obviously not to push them, right, to a great extent, because we want to slowly remind them or, be nice to them, but at the same time tell them, hey, this is very important for you. you got to do this. And then, of course, when they are new to the program, they are learning. And so after about a month or so, they get used to it. And then they know this is so helpful. Then they realize the benefits of it. And then it becomes more easy for them.
Gotcha.
So that's the second category, which is the ones who need a nudge. And then you have those category, which is at the bottom, right? Where, it's just too slow. They are not as engaged, and, they need more reminders, more alerts. So we always tend to work and customize our program and make sure that those that are in the bottom of the list, get to the middle. And then those that are middle, we try to keep them up, engaged as well.
Gotcha. So now let's talk about the challenges in healthcare. Like you're a mom and you wanted to start this, and kudos to you. And the healthcare is very challenging. Can you talk to me? So first you had the idea. What did you do next? What was your next step?
So, well, I worked with, a couple of providers who were in the space. And I also worked with our technical, our CTO, and kind of thought through sort of the whole process, thinking through, what is it that's going to be useful. And we never really started off as a, remote patient monitoring company, because obviously I had my daughter's story with me. And it was important that we focus on building an app, perhaps, right, that could help patients. So that's how we started our journey, thinking through the app. And then we were at the time of COVID, where everything just started happening from home. It sort of struck to us that, hey, if we really want to take this forward, then we really need the whole platform approach, because we need to add on things like devices and other technology that's going to be even more helpful to the patients, because we could see these patients couldn't make it to the doctor's office, or even if they went, doctors didn't want them to come because of COVID. And so how could you now have something besides an app that could also monitor vitals, that could, especially with lung function, because spirometry is all about breathing in and out. And so when you had COVID, a lot of spirometry just stopped because obviously you're going to use the device, breathe in, breathe out. And so it was important for us to bring in the remote spirometry so that they could sit at home and perform these measurements without having to go and get an appointment with a pulmonologist. And so that's why our journey went from creating an app to then building the platform. And the third piece of it was our care team.
Gotcha. How did you acquire your first customer? So you built this app and then you designed the platform. So now the first customer, which is like very challenging in the healthcare.
Yes, absolutely. And I couldn't agree enough that it's even more than challenging, whatever the word for it is. And little did I realize that, commercial model, bringing a healthcare product into the market is not easy, because you have so many different products out there, and your ultimate customer, right, which in our case was the physician, sometimes is daunted by so much out there for them. And they are still trying to do their regular day jobs and manage patients. And, here we come, hey, there's something new for you. So I would have to admit that part, and it still continues to be somewhat of a challenge, because adoption is really the key, right? You can keep the cost aside and you can keep perhaps the technology aside, but adoption to me is very, very critical, especially when you're launching products. And how is somebody accepting a product? What's the story? How are you going to scale the solution? So these were all questions that came into our mind. But when it came to our first customer, it was probably, we had actually hired a sales consultant.
Gotcha.
And because we realized, I don't think we can do this on our own. And of course, we had a very nice advisory team, and people were willing to help us. And we had done a lovely sort of excellent validation study, working with a big healthcare center. So we had a lot of, sort of support in some ways, but yet, we were out there as a little company in this ocean of healthcare and trying to find, who's going to be willing to join hands with us and collaborate, and who's willing to put their trust in us, right? And all of those pieces come into play because you're new out there. And so yes, it was a lot of hard work before we came across, and I think at that time we also were very new to learning about things like lead generation and setting up databases and learning how to do a sales pitch, because as a founder, most of your time is invested in developing the product, and so you have to come out of that shell and talk to the customer or talk to your potential customer, and then you have to keep that piece behind, right? All the hard work that went in the product has to stay apart, has to stay a bit away, and you have to focus on sales. So that transition, trust me, took me some time. And sometimes I still struggle with it because obviously you're passionate, right, as a founder, to make sure you sell. That piece doesn't go away. But frankly speaking, when it comes to sales, it's a whole different hat that you wear. And I'm still learning. But all of this came together, when we got some insight from the sales consultant that we got. Obviously, I spoke to a lot of people in my network to learn. They suggested me some approaches to use. But yes, it's extremely tough. But the good news is it happens.
Yes. I think realizing your weaknesses and hiring your weaknesses is the ultimate thing as a founder. Like, you can't do everything on your own.
Yes, absolutely. And I think that was also a lesson we learned is, to be able to reach out to people whom you need, but also, networking, learning from other stories, talking to other CEOs, or maybe people in sales. I mean, I still benefit a lot from talking to people who are either head of sales, VP of sales in bigger companies, asking them, what are some techniques you use? Or somebody taught me this magic number 7, which means you need 7 interactions from the time you start talking to a potential customer for something to actually happen. And I would just, I thought that, hey, I could send an email to someone and say, subscribe to our program or, services, until I realized that it actually takes much more than that. You go through the different stages of the sales process and you convince your customer, you give them time, you provide them with the information that's needed. And so, all of these little nuggets, there were some things we knew for our first customer and some things we did not.
Yeah. And so to acquire your first customer, you hired someone to help you with sales. And now that brings us to the next question. How did you find, and I don't know if you're still in that stage, seeking funding? It's very challenging. Do you have any tips or tricks to convince people, and when you are especially seeking more funding to grow your platform, to grow your app, any lessons learned from there?
Yes, and of course, I could spend hours and hours talking to other founders and other interested folks about my experiences. But if I were to, sum it all, I would say investment or getting money for investment is also a very, time-consuming process. So as a founder, you have to decide how much time do you want to be able to give, because you still have to develop your technology, you still have to sell. And there's always the chicken and the egg problem, which is, you got to sell enough and you got to have enough customers before you go to the investor. So what benefited me was actually doing some of the accelerator programs, working with different groups who essentially offered lessons on, how would you pitch to an investor, how to create a pitch deck, how to make sure you address, your value story, what are the different, aspects that are needed that an investor is looking for. So it was very important to understand and put yourself in the shoes of the investor, saying, why would I put in X amount of million in your company? And that learning, frankly speaking, doesn't come on day one. And it doesn't come, on day 365 either. It takes time. It takes a lot of calls and a lot of meetings and a lot of pitching, right? It could be, pitching multiple times. And every time I remember we had so many different versions of our deck. We kept on updating, we kept on making changes to it because, hey, as soon as we got our first customer, oh, let's make sure we put it in our investor deck. Hey, as soon as we signed our first partnership, let's make sure we add that, right? And then as your pipeline grows, you want to make sure you update it. And so I don't even know how many versions of our deck, our pitch deck that we worked on. So nothing stays consistent, but you always grow and you always learn. So I used a lot of these accelerator programs to simply pitch. I would get 2 minutes to pitch. I would get 20 seconds to pitch. And I took all of those opportunities to learn how to do that piece. And so once you've been able to do that piece, then it builds that confidence. And then I would say, once you start building and getting your customers and you're in the revenue generation phase and you're scaling up, there's a different level of maturity that comes within you. Because now you're talking business, you're talking money, and it somewhat eases your path to also talk to investors. Because at first you were in that idea phase where, wow, this is going to be the coolest product that I've ever built. But when you start doing the business and when you start your creating your P&L sheet and your ARR, understanding what your revenues are going to be in 2 years and 3 years, your model, to me that is where you're heading up and you're understanding those pieces, and that makes you much more comfortable to ask for an investment raise. So I would say that in the initial months I was not well informed, or I was still learning the tricks of doing this piece. But as we grew, we did actually a crowdfunding raise last year. And this year, we are obviously doing our second seed round as well.
Oh, wow.
And so it was important that, everything was new to us in the beginning, but as we learned, we kind of matured. And now when I speak to investors, I try to talk in their language because I know what they're looking for, or I try to ask the right questions. And again, I'm still learning, but it's very useful when you try to put yourself in the shoes of the investor. And it doesn't come initially. It comes in later on stages as you're maturing your product, as you're out there. So my usual advice, to founders is to give some time. Yes, the pitching is important. Learning how to do those pieces is important. But when you're in the revenue generating phase and when you're scaling up and you have customers, you will see that your confidence and your maturity to talk to those investors evolves. And it makes you much more confident. And then, of course, once you have that type of funding, when you get into Series A or further, then that maturity just keeps on increasing because you know more than what you did before.
That's very inspiring. I think it's just like raising money is just like any other skill, right? It's just like sales. It's just like creating products, just like acquiring your first customer. It's like it's another skill that you learn and you become better at doing over time.
Yes. And it's not, I don't think it's written in a book. I wish, it isn't written in a book. but you learn it from your experience, and you also make mistakes, right?
Right.
So you learn it from your mistakes, which is actually very important.
I agree. I
So,
agree. And what inspires me more about your story, like, um, as a female founder and a mother, like, what challenges you faced? Because, like, you are taking care of your family and you're trying to create your company and build your company and trying to raise money. Uh, what were like the biggest hurdles that you had to overcome to be where you are today?
yes, that's a great question. And thank you for asking that question. It's something that is so important, as you prepare your mind, that you are going to do this, you need a lot of support, right? You need your immediate family, you need your network. Everybody has to chime in, right? There's some input that you will need, there's some support you will need from them, whether they are closely involved with your product or not. So for me, I'm very thankful for my family. Because they've helped me support, given me the support that I need to be able to carry out, and sort of run the show. Um, and yes, as a mom, it is not easy because there's obviously days where you want to be with kids, and on the other hand, you have these customer calls coming, or you have some patient calling you, or you're sort of in that boat where you're trying to juggle. So the art of juggling, I think, is what every mom needs to learn when you're doing a startup, because you're kind of invested yourself fully in it. But your family is important, your kids are important, and you have to take a break sometimes, right? You have to relax your mind. Just playing a game, with my children, a family game, sometimes is so helpful, because it just de-stresses you out and tells you that, hey, there's more to it, right? There's more fun to it than what you really think. And things will happen, especially in times of when you go downhill, right? And when something did not work out and as you expected, the first person you reach out to is your family, right? Your husband, your kids. And so for me, I have a lot of appreciation for them, because and still, as we go through this journey, they've been very supportive. And I'll give you a small example. Um, my two daughters, they actually helped me pack the boxes of devices that we were giving out to patients in the first few practices that we worked with. And I did not have any help. I'd not hired an operations person. And it was our first few customers. And so they all sat with me in the living room, and I got the stickers printed. We opened up the boxes. It was a family thing we all did together. And we shipped a few boxes out. And I still have pictures of doing this. But the bottom line is support and your family helping you.
Sweet, sweet. Thank you so much. Appreciate it. And my last question is, we can't do an episode without talking about AI. Where do you see AI, if there is a possibility to integrate with the platform and try to use the data to predict more future outcomes?
Yes, that's an excellent question, Rupen. And so the good news is that we've been thinking of AI all along as we built this product. So I'm super excited about all the possibilities that AI has. I think in some ways, right, we're all using AI. I still remember, having started using ChatGPT for some of our marketing content. And so I would say at this point, we've definitely used some forms of AI to do parts of the business. And, perhaps a year down the road, I do see a lot of changes coming as we transition from, replacing some of the work that is being done within our system. So, for example, alert generation or anything, handling patient queries and things like that. Of course, there are already remote assistants, and you can even get a remote admin and things like that with AI. So I'm pretty positive, if it is used in the right way, I think there will be many more opportunities there. What I'm super excited about is all the data that we have. So we are into respiratory care. So a lot of lung function aspects that are measured could use AI in order to help with some sort of detection of exacerbations, flare-ups. And we really haven't done all this work. We have all the data, but I'm super excited about collaborating, working with either companies or academic institutions who want to use this, and then create some sort of a model for mild, moderate, and severe patients to see if we can enhance the detection capabilities rather than having sort of the care team approach. Could we have some of it done by AI?
And that brings us to the end. Thank you so much. Any last words? If you're going to tell, what would you tell yourself 5 years ago? What would you tell your younger self?
What would I tell to my younger self 5 years ago? I guess if I had to sum it up, I think it's important that people do what they would like to do in their lives. And if you get an opportunity, to be an entrepreneur, and if you have the support of your family, then go do it. It's exciting. It's challenging. It helps you, walk on a road, and then maybe you meet with an accident or you fall down, but then you learn how to get up. And that is the beauty of running a startup. So my suggestion to everyone is go do it.
Thank you so much. Thank you so much. I really appreciate it. And thank you so much for being here today.
Sounds great. Thank you so much for inviting me. It was a pleasure talking to you, and thank you for inviting me to the podcast.